This video will take you through some of the common causes of knee pain, front of knee pain, when you're running. So we'll go through a range of things that can be contributing to it, and I'll go through what's generally one of the more common reasons for that knee pain and a suggestion of how to combat that. I know that you want to keep running, really despite any pain, but it's certainly good to get it sorted sooner rather than later. And that's where I can help you with just trying to get back to pain-free running. At the end of the video, we'll go through what you can do to get yourself a targeted leg flexibility routine, and we'll also detail where to go for help if you need. My name's Claire, I'm a physiotherapist from PhysioFit Health. I'm here really to help you just try and reduce any pain that you've got so that you can get yourself running. To get more from our expertise, feel free to subscribe to our YouTube channel so you can keep updated with all of our videos. It's really important to note that pain is fairly complex, and it's a little bit too simplistic to say that one thing will be causing you the pain that you're getting. It's generally a whole range of different things, and it's a question of really unpicking which ones are the main ones that might be contributing to that pain. So this video is not designed as medical advice, it's just a general information video. If you do need help, please get yourself booked in for an appointment, and that's where you can just discuss your own situation, and your own medical history will be taken into account, and then you can get more specific advice. As pain isn't necessarily linked to muscles, then that's really what the physio can help you with. Just doing a load of tests and different movements just to help identify the possible causes, and then that can give you the steps forwards that you need to know where you're going. Different causes for that knee pain you might be finding. Sometimes the knee pain can be a little bit non-specific. You can't really find it or touch it anywhere. So potentially then the low back can refer down. The hip can also refer down to the knee, or your ankle can refer up. So the problem might not necessarily be the knee, even though you're feeling the pain there. And so it's important just to kind of look above and below, just to see what's going on elsewhere. You can get different arthritis in the knee. Osteo is the most common one, but you've also got your rheumatoid and a little bit more systemic arthritis that also might be contributing. So with those, it's important just to figure out if that's the case, as you'll need your own different management for that. You can get tendon irritations above or below the kneecap, and that can be causing a little bit of pain. You can get cysts that are around the knee that can cause a little bit of pain. You've also got cartilage tears that sometimes can be causing pain. Although it's really important to note with the cartilage tears, as an example, you get people with cartilage tears, and some will be having pain in the knee, and others won't be having pain. So then the cartilage tear isn't necessarily what's going on in the knee. And that information really opens out another conversation, which we won't go into the video today. But there's other aspects to pain that might be contributing, and it can even be anxiety can increase pain. Stress can change the hormones in the body. You can pick up on pain a little bit quicker. If you've got pain anywhere else in the body, it actually makes the body a little bit more sensitive, and so you're more likely to pick up on pain elsewhere. So there might not necessarily be an actual problem elsewhere, it's just that the body's got a little bit more sensitive. Like I say, a little bit of a whole extra conversation on pain, but it's just to try and show you all of the different elements that might be contributing to the pain. Unfortunately, with knee pain, weight has actually been shown to affect the pain. And so losing a little bit of weight has been shown to reduce the pain that people feel in the knee. And last but not least, it could be just some muscle tightness above the knee or the calf at the back. So yeah, that can be contributing. One of the really important questions you need to ask yourself is, have I been doing enough stretches for my legs? Or have I not been doing any stretches at all? Generally, I do tend to find that people just want to run. They're not really that interested in doing any of the stretches or the massage around the legs. However, that can be part of the cause of the knee pain. As a suggestion, you can work on loosening the muscles, particularly the muscle at the front of the thigh. That's the one that's generally giving some of that knee pain at the front of the knee. So if you watch this short clip, I'll explain how to use the foam roller on the quads, which are the muscles at the front of the knee. You're going to get your leg onto the foam roller. So like I said, the quads are at the front of the thigh. They do wrap round a little bit. So starting out, you're going to get the front of your thigh on the roller. All you're doing is rolling up and down. Now, you want to just keep in the muscle belly area of the quads. So you don't want to get the pressure in and around the kneecap. That's going to be way too sore. And also up around like the hip and the pelvis. It's just quite a lot of tendons around that area. So your best bet really is kind of central quads, central front of the thigh, rolling up and down. But as the quads wrap round, if you're doing the right one, you're just going to rotate and roll on that right side. If you answered yes to the question about whether you've been massaging and doing all of these stretches, so if you have been doing a lot of stretches and you're still getting knee pain, that's when I really think you need to be getting a little bit of advice just to see what else is at play. And what you need to be targeting. So yeah, if you tick that box, stretches, and it's not really helped that much, it's then looking at different causes. That's really where the online physio appointment can help you, because that's where we can have a little bit of a chat about what you have been doing, what your symptoms are, and then we can identify the steps you need to do just to progress yourself forwards. If you are interested in improving or maintaining your leg flexibility, if you know you haven't been doing that many stretches for the legs, we have a 8-week deep squat challenge that you can sign up to. The information is in the description below. And what will happen is you'll get an email each week and you'll target different areas of the leg. So starts at the ankle, you get different exercises around the ankle to try out. Moving up to the knee, the hip, the low back. And then at the end of it, you'll come out with a little bit more of a targeted exercise routine, really a little bit more specific to your own individual circumstances, because you'll explore that during the challenge, just to kind of figure out where feels tight in the legs, which will then direct you as to what kind of stretches you might need to be doing. So yeah, details in the description below. To summarise what you've been finding out in this video is really the importance of figuring out if you have been doing enough stretches or massaging around the legs. So if you haven't, if you've just been running and you're starting to get your aches, pains, niggles around the knee, then get yourself on the foam roller, get yourself to a massage, just see if that helps kind of settle things down a little bit. If the issue is caught early enough, it is a little bit easier to sort out. However, if you've had the issue for a little while, then it can be a little bit more involved just to figure out what's been going on and how to unpick it. The easiest solution if you are confused, if you've tried a few things and you just don't really think they're working, is to book an online physio appointment. We'll help you just go through what's been going on, what you have been trying, and it just identifies what the potential causes might be, which then gives you the structure of what you need to do to go forwards. I know you just really want to get out there and run, and that's what I'd love to help with. I know how important it is for a load of different reasons just to get out there and enjoy your running, and so we want it to be as pain-free as possible, and that's how I can help you. See you soon.